One of the most common infectious diseases is a highly contagious airborne disease that occurs in a seasonal epidemics. Hey everyone, this is Mad Amigos. Flu is a contagious respiratory illness caused by influenza viruses that infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. Flu is different from a cold. Flu usually comes on suddenly. People who have flu often feel some or all of these symptoms: fever, cough, sore throat, runny nose, muscle or body aches, headaches, and fatigue. However, some people may have vomiting and diarrhea, though this is more common in children than adults. Symptoms can begin about 2 days after the virus enters the body. That means that you may be able to pass on the flu to someone else before you know that you are sick, as well as while you are sick. Some people can be infected with the flu virus but have no symptoms. During this time, those people may still spread the virus to others. Most experts believe that the flu virus spreads mainly by tiny droplets, made when people with flu cough, sneeze, or talk. These droplets can land in the mouth or noses of people who are nearby. Less often, a person might get flu by touching a surface or object that has the flu virus on it, and then touching their own mouth, nose, or possibly their eyes. When an infected person sneezes or coughs, more than 500,000 virus particles can be spread to those close by, and otherwise healthy adults. Influenza virus shedding increases sharply 1/2 to 1 day after infection, peaks on day 2, and persists for an average total duration of 5 days, but can also persist as long as 9 days. Influenza virus can be spread in 3 main ways: by direct transmission, when an infected person sneezes mucus directly into the eyes, nose, or mouth of another person; the airborne route, when someone inhales an aerosols produced by an infected person, coughing, sneezing, or spitting; and through hand to eyes, hand to nose, or hand to mouth transmission, either from contaminated surfaces or from direct personal contact, such as handshake. The relative importance of these 3 modes of transmission is unclear, and they may all contribute to the spread of the virus in the air. In the airborne route, the droplets that are small enough for people to inhale, including just 1 droplet, might be enough to cause an infection. Although a single sneeze releases up to 40,000 droplets, most of these droplets are quite large and quickly settle out of the air. How long influenza survives in the airborne droplets seems to be influenced by the levels of humidity and UV radiation, with low humidity and lack of sunlight in the winter aiding its survival. Ideal conditions can allow it to live for 1 hour in the atmosphere. As the influenza virus can persist outside of the body, it can also be transmitted by contaminated surfaces, such as banknotes, doorknobs, light switches, and other household items. The length of time the virus will persist on a surface varies, with the virus surviving for 1 or 2 days on hard, non-porous surface, such as plastic or metal, and for about 15 minutes on dry paper tissues, and only 5 minutes on skin. However, if the virus is present in the mucus, this can protect it for longer periods, up to 17 days on banknotes. Antiviral drugs can lessen symptoms and shorten the time you are sick by 1 or 2 days. They can also prevent serious flu complications like pneumonia. For people at high risk of serious flu complications, treatment with antiviral drugs can mean the difference between milder or more serious illness, possibly resulting in a hospital stay. Influenza spreads around the world in yearly outbreaks, resulting in about 3 to 5 million cases of severe illness and about 290,000 to 650,000 deaths. There are 4 types of influenza virus. 3 are known to infect humans, type A, B, C, and D. Type D has not been known to infect humans, but is believed to have the potential to do so. Finally, hope this information was useful. Please stay safe, wash your hands regularly, and avoid touching your face. Stay at home. See ya!